In this video, we're going to discuss the joints of our body. Our learning objectives are to classify joints both functionally and structurally, as well as to talk about the subtypes of synovial joints and classify those by plane of motion or shape. We also want to describe the microanatomy of a synovial joint and compare various forms of arthritis. Now, joints are sites where two or more bones meet. The other word for a joint is an articulation. And the function of a joint is to hold bones together while also allowing for mobility if mobility is needed at that site. We can classify joints functionally by what they do, how movable they are. Synarthrotic joints are immovable, amphiarthrotic joints are slightly movable, and diarthrotic joints are freely movable. We can also classify joints structurally by what physically separates those bones and makes that joint. And from there, we have three structural classes: fibrous joints, which are made of collagen fibers; cartilaginous joints, which are classified by the cartilage that joins them; or synovial joints, which have synovial membranes. We'll spend most of our time focusing on the synovial joints. The fibrous joints are generally immovable, whereas the synovial joints, those are freely movable. The fibrous joints have, again, that fibrous tissue. Sutures, this is what you can think of joining the skull. They have irregular edges that interlock and are bound by connective tissue, mainly collagen. We also have syndesmosis joints, which are slightly movable, like the one between our fibula and our tibia. For cartilaginous joints, these include the syndrosis between the sternum and our ribs. It's immovable, it's made of hyaline cartilage, and it can actually ossify with age. You can also think of these as like growth plates between our long bones. We also have a symphysis, which is a slightly movable joint, like in our spinal cord, made of fibrocartilage, or in our pubic symphysis, which helps keep our coxal bones together. And in women, this joint will actually stretch as the woman's body prepares for childbirth. Now, our synovial joints, these have special features. They have hyaline cartilage, which we call articular cartilage or joint cartilage, that covers the bone. And they have a joint cavity that is filled with synovial fluid and is lined with synovial membranes, all enclosed in fibrous tissue and reinforced by ligaments. And that articular cartilage and the fluid, all of that helps create a smooth gliding surface to decrease the friction of our joints. So synovial joints are made to be movable. Some specific terms to keep in mind: we have bursa, which are flattened sacs lined with synovial membrane, and we have tendon sheaths. So you can have bursitis or bursa sheath, and this will be very painful processes. Again, all of these structures help to decrease the friction of movement. Synovial joints are diarthrotic, so they are freely movable. They are filled with fluid, and they're the joints that we typically think of, our limb joints. And our synovial joints, we can classify the subtypes by plane of movement, whether it is multi-axial, like in our shoulder and our hip, it can move in all directions; biaxial, 2 motions; uniaxial, 1 movement. So uniaxial joints have 1 plane of motion. You want to think of things like your ankles, your elbows. Your elbow is the classic example, right? It goes only in this direction. Biaxial joints have 2 directions. So our knuckle joints, you can move your finger this way and you can move it that way, 2 directions. Okay, let's talk about synovial joints by shape. So the plane joints, this is, you want to think of the intercarpal joints of your wrist. You can spread your hands out and move these bones. They can slide and glide past each other. So this is a non-axial movement. No rotation, just sliding and gliding. Hinge joints, again, you want to think of the ankle and the elbow. This is where you have a cylindrical bone 1 that will fit in a trough-shaped bone 2, giving us that uniaxial motion. Pivot joints have a rounded head of one that will fit into a sleeve of a second one. This is things like the atloaxial joint in our neck, the radial ulnar joint that allows you to twist your arms over, back and forward. And this, you're only getting 1 turn around a long bone, so it's also considered a uniaxial joint. Now we have our condylar joints. This is where you have an egg-shaped bone that fits into an oval concavity. And these are biaxial. They allow side to side and back and forth, but not a full 360. So you can look at condylar when you move your knuckles, right? You can't move it in a full 360, but you do have a large range of motion. The saddle saddle joints have an even larger range of motion because their surface has both a convex and a concave area. It's still considered biaxial, but it's a greater degree of motion. So let's compare the motion of our fingers, we can make little circles, versus our thumbs, bigger circles. Condylar for the fingers, saddle joint for our thumbs. Bigger degree of motion, still technically biaxial. And finally, the multi-axial joint, our ball and socket. This we think of our shoulder and our hip, where we have a head of bone 1, which will fit into a deep socket of bone 2. Lots of motion there. If we have issues with our joints, then we're talking about things like bursitis, which is an inflammation of that synovial membrane, usually from a fall. Sprains, when the ligaments or tendons of a joint are damaged and tear away from the bone, usually due to an overstretching. Let's end by talking about arthritis. So arthritis includes over 100 inflammatory and degenerative diseases of our joints, all of which have pain, stiffness, and swelling. Osteoarthritis is the most common. We'll talk about rheumatoid arthritis, which is an autoimmune disease, and gouty arthritis, which is a buildup of uric acid. So osteoarthritis, this is what you typically think of when you think of arthritis. Age here is the biggest risk factor, and it's not a crippling disorder, so you can still move. But there's a breakdown of our cartilage, and you can start to develop bone spurs in those exposed areas. So you'll hear crepitus, which is a crunching noise when you move, not the typical snap and crackle that most of us feel or hear when we move our joints, but a crunching like paper. And the most common arthritic joints are going to be our fingers, our spine, our knees, and our hips. Rheumatoid arthritis is an autoimmune disorder. So the age of onset is a little younger. It's our 40s and 50s. And like all autoimmune disorders, women are more affected than men. And the interesting thing about rheumatoid arthritis is that it affects joints symmetrically. So if you feel it in your elbow, you'll typically feel it in both elbows. And it's characterized by a series of remissions and flare-ups. You'll feel better, and then you'll feel worse, and then you'll feel better, and you'll feel worse. And it's not always clear what causes those remissions or flare-ups. The thought is that we have some sort of inflammation in our membrane that releases a molecule called a cytokine, and then we'll start to signal the buildup of scar tissue, which will start to turn to bone. The treatment, unfortunately, for this is just immune suppressants, trying to stop that immune system from attacking our joints. And finally, we have gouty arthritis, and this is caused by a buildup of uric acid crystals in our joints. Usually it's in the toe. It's a painful attack just in one joint. And for this, males are more commonly affected than females. Risk factors can be genetic, and if untreated, it can cause the joint to fuse together and you'll lose movement in that joint. And the treatment here is to decrease uric acid. So you get uric acid from alcohol, from foods that are high in nucleic acids like livers and sardines or lots of red meat. So you want to limit that. Lose weight to stop the pressure on the joint, and you can try a drug called colchicine, which can sometimes help. So in this video, we talked about our joints and arthritis or diseases of the joints, and we'll end next time with a short video about developmental aspects.